Here, Carol.
Hi, it's good to be here.
Few years ago, actually, I would have never thought that I will be having an interview with you,
Oh,
Dr. Carolyn McMakin.
yes.
Actually, I can say living legend, my teacher,
Yeah.
master,
Yikes.
mentor. And here on Hawaii, on Big Island, with this splendid view behind us, after attending Master Class, Frequency Specific Master Class, which was absolutely mind-blowing for us all.
Extraordinary.
It was extraordinary. Yeah. And I was thinking before preparing this interview, life is full of surprises, isn't it?
Quite, yes.
As you know, I met you first time 2017.
Right.
It was 7 years ago in Germany, when the TimeWaver McMakin was introduced.
Right.
And for me, it was like a new earth which showed up. I would have never thought there is something like a game changer for us practitioners and doctors. Now, actually, from this time, I have been working with TimeWaver McMakin and supporting my patient in Poland with fibromyalgia, with chronic pain. I help them with their wounds, with depression and other issues. For me, it's obvious that FSM is something special, but for the people who will watch us, the audience of YouTube, tell us, please, what is so special in FSM and actually how FSM works. What is it, FSM?
FSM stands for Frequency Specific Microcurrent. And I got a list of frequencies from an osteopath who bought a practice in 1946 that came with a machine that was made in 1922. That machine came with a list of frequencies that were used with that machine by doctors from about 1908 through 1922 when the machine was built. So from the osteopath, I got a list. And there's a list of conditions that make cells or the body not function correctly, like inflammation and scarring and toxins.
Right.
And there's a list of tissues. So the basic principle is if you remove the pathology from the tissue, then the tissue will work better. Over the years, it's become obvious because the first time I used it was 1995, so 30 years ago.
Yes.
And we started with the idea that the frequency just canceled out the pathology. It's more sophisticated than that. So it's like on the outside of a cell, there are little receptors that tell the inside of the cell what to do. And when something like inflammation changes that receptor from this position to that position, and you run the frequency to remove inflammation, it appears that it changes the receptor back to the way it was and changes the cell back to normal function. The physics of it is complicated, but the practice is very easy. We use frequency specific therapies every day when you unlock your car. So you have a little key fob that sends out a signal. There may be 10 gray cars identical in a row, and you push your key fob and only your car opens. That is a frequency specific signal that goes from the key fob to your car. So what we found over time, just by using it clinically, was to pay attention to the list. You look up, if a patient has nerve pain, for example, you look up what causes nerve pain, and it's inflammation in the nerve. Well, on the list, there's a frequency for inflammation, and on the list, there's a frequency for the nerve. So when you connect the contacts from the microcurrent at the beginning of the nerve and the end of the nerve, and you run the frequency to reduce inflammation, nerve pain goes away. And then you do that the first time, and it's a surprise. You do it the second time. And after you've done it 10 times, then you can predict that if someone comes in with nerve pain and you run that frequency that way, it's going to remove the nerve pain. So nerve pain is really the easiest thing we treat. And the rest of it has just evolved over 30 years. Teaching it was my way of finding out if it was reproducible. So the fact that you can do it is what's important. If I was the only one that could do it, that FSM worked for, it would not be useful. The fact that I can teach you how to think about it, and how to use it to help your patients with wellness and comfort and balance. I was very happy to collaborate with TimeWaver because it's such an ethical and precise company. They create very good quality products, and the TimeWaver McMakin, I think, is approved as a medical device. And so the applications, how to think about how to use the frequencies, that takes 5 days to teach the basics. And then, as you found in the master class, it's an ongoing and constant learning process for the therapist. And it's amazing to me to have you call me a legend or whatever, and it's like I'm just a practitioner. And what's amazing is that the frequencies do what they do. That's what's magic. The fact that I've figured out how to teach it, and that you've figured out how to take the teaching and help your patients, that's the important part. Yeah.
For me, the most amazing part when I met you was that one day in the 90s, you got the list of frequencies. You are a very grounded woman, scientific based. So it was not like, oh, I believe it, I will do it. You had to figure it out. You have to experience it, not once, many, many times. And you found out, first, it's working. But the amazing part for me is you didn't keep it for yourself. And I have goosebumps now because FSM, Frequency Specific Microcurrent, is known all around the world.
Just now.
In the States, in Europe, in Africa, in Asia, in Australia, actually everywhere.
We have 4,000 practitioners in 23 countries now. And there's a saying, you only get to keep what you give away. So if I was the only one that could do it, it would be meaningless. Exactly. And because I can't see that many patients, and our purpose here in this life on this planet is to help each other. So if I help you and you help others, it's like ripples in a pond, and all the good spreads. And it, when you change even one life, it changes the planet. It changes that patient's world, and it makes the whole world a better place.
Yes, so, this well-known butterfly effect.
Yeah.
So that's why, as president of the Polish Association, as you know, for Energy and Information Medicine, I'm extremely happy that we will have you in September the 7th in Poznan, in the 3rd International Conference for Energy and Information Medicine.
Wow.
You will be actually telling all the audience in 1 hour everything based on your 30 years experience. But tell me, what would you say to a practitioner or a doctor? Why is it worth it to work with FSM, with devices like FSM device, TimeWaver McMakin device, or others? Why is it worth it?
There's 2 reasons. One is why physicians practice in the first place, which should be, I think, to help patients. So in medicine, there are some things that medications can do and surgeries can do, and there are some things that it cannot. Treating nerve pain is very difficult. Treating full body fibromyalgia is difficult. Treating thalamic strokes, phantom limb pain is impossible. And with FSM, it's really easy.
We saw it today, yesterday.
Yeah, so there's to help the patients, but honestly, from a practitioner's standpoint, the reason to learn FSM is that it's the most fun you'll ever have in practice. It's you do this, and you can honestly say it's not that hard.
No.
It's you have to think, you have to know the basics, you have to listen to the patient, do a physical exam, but then the treatment is just fun.
Yes.
And to be able to change a patient's life that fast, it's not always that fast, but in 2 weeks, in 60 minutes, and then follow up over 2 to 4 weeks, is an extraordinarily rewarding experience. And it doesn't suit everybody's mind, and that's fine. That's why it's worth it, is whether you end up doing it as part of your practice or not. It's a way of looking at patient health, pain, dysfunction that's a little bit different. FSM has to treat the cause, so the practitioner has to think about, it's not like my back hurts, so I'll give you a pill. It's, why does your back hurt? Well, because the cartilage and the bone is inflamed. Well, the pill takes care of the inflammation, sort of, but with FSM, it actually changes how that tissue functions, we think, because the back pain gets better, stays better, and we give the patients exercises to teach them how to keep their recovery more permanent. So that's why it's worth it. It's fun. and you can change a life, and that changes the world.
I would add one thing from my perspective, which is subjective, of course. It requires determination and devotion. You have to be open to dive in it, because for me, FSM is a life, never-ending journey, story. I told you a few days ago, the more I learn, the more I'm aware how much there is still to improve.
Yeah.
But it's such fun first, and also it makes your heart feel warm when you feel how many lives you can change.
That's true. And the more you know, the more you learn, then there's the more you have to learn, because there are so many things that you can affect. So when you change, for example, how someone's foot works, that changes how their knee works. And there's actually frequencies that help us connect the brain to the foot so that it helps with the coordination. So the patient now walks better, and it's something you wouldn't think of unless you had a tool that let you do it, right? So it's good for people with a low boredom threshold, that enjoy learning, that actually care about getting people better, and that understand, like to understand, people that enjoy understanding how things work and how to intervene in a reasonable way. Yeah.
We both know, and actually people which are on the same page we are, that humans are multidimensional creatures. So we have, of course, physical, biochemical level, we have emotional and mental level, but also we have energetical level and informational, spiritual level. There is also our environment, which is very important. Do you think that FSM is perfect for complex creatures like we are?
Oh, perfect is a big word.
I know.
It is multidimensional. So there are frequencies for the parts of the brain that create emotions. There are frequencies for specific emotions that were on the list. There are frequencies for the nerves that convey the effects of the emotions to the body. There are frequencies for certain psycho-spiritual aspects. And what you use them for depends on how you look at the body. My challenge to the practitioners is to do what the patient needs, not what your idea about it is. So for some people, they think everything is emotional. Well, the nice thing about FSM is if you use the frequencies for emotions and it doesn't do anything to change the situation, you know that it's not emotional. So you have to have a flexibility of mind and say, well, okay, maybe the low back pain is just low back. It's not because of an emotional thing. So you treat that, and if that works, then you were right. It took 5 years and 50,000 patient treatments for me to become convinced that the frequencies always do what they are described as doing. So scar tissue only dissolves scar tissue or softens scar tissue. Sclerosis only makes adipose softer. Inflammation only affects inflammation. It doesn't do anything for scar tissue.
Mm-hmm.
So it has proven to be that over time. So in that way, it creates in the practitioner a flexible mind about your idea about how this complex organism all fits together. So, for example, if it's somebody's knee hurts and it creates a memory of a trauma,
Mm-hmm.
you can, if you want, let them stay with that for a while. And then there's a frequency to soften the impact of that memory in the part of the brain that retains the memory of the trauma.
Mm-hmm.
You just run that frequency for a few minutes and you watch the patient's face, and they become less upset, aggravated. Oh, they relax because that part of the brain that is stuck in the trauma, you've just had a frequency that gave you the ability to change that. And if it works, then you are right. And what we found over time is that it never doesn't work.
Actually, you know, I could have this conversation with you forever. I know that somebody is waiting to have the next interview with you.
Yes, but I'm very excited about being at your conference. It's a wonderful opportunity to talk about the science behind FSM. We're lucky enough as an alternative therapy to have some research.
Yes.
Basic science research, some clinical research, and the outcomes, the statistics, the data is quite dramatic. So it's exciting for me to have an audience that is not only interested in energy medicine, but interested in the science of it, because it's not ethereal, it's not voodoo, it's physics. And it's a physics that applies to the human system and creates better lives.
That is what I will be talking about in the water conference.
Yay.
Of Jerry Pollack, because wish me luck. I will
Thank you.
give my best to connect frequency specific microcurrent with water. And I will tell the audience is everything based on science.
It ends up being science.
Yes.
Science is not a body of knowledge that you need to protect. It is a method of study.
Of course.
That produces an understanding of how things work. And I'm excited for you. And I'm really pleased to be part of it. Thank you.
Thank you so much for this inspiring conversation.
My pleasure. Thank you.
And for this whole week on Hawaii, I have been talking today with colleagues of mine and your students as well, that now we will need some time to metabolize it.
Right.
Just allow me to say a few words about the conference.
Sure.
Please, if you would like to meet live Dr. Carolyn McMakin, please join our conference in Poznan, the 3rd International Conference for Information and Energy Medicine. It will be September the 7th. You just need to click the link below, and there you will find tickets. There are still some available.
Oh, good.
And see you in Poznan in actually 2 weeks.
There we go.
Wow. Thank you.
Bye.